Hi, my name is Dr. Tolu, and in this video we are going to be discussing the truth about intermittent fasting. We'll be looking at the benefits of intermittent fasting, the potential drawbacks of intermittent fasting, and we will finally be looking at how to practice intermittent fasting safely. For those who don't know who I am, I'm a medical doctor, medical content creator, and my videos on weight loss have been watched by hundreds of thousands of people all over the world, and they've helped many along the way. So guys, let's begin. First things first, what's intermittent fasting? Like the name suggests, intermittent fasting is an eating pattern that cycles between periods of eating and periods of fasting. The most common methods are the 16-8 method, where you fast for 16 hours and then eat within an 8-hour window. The 5-2 method, where you eat normally for 5 days and then you limit your calorie intake to between 500 and 600 calories per day on 2 non-consecutive days. And the eat, stop, eat method, where you go on a full 24-hour fast once or twice a week. As you might have noticed, in intermittent fasting, the focus is less on what you eat and more on when you eat. Next, let's look at the science-backed benefits of intermittent fasting, because yes, there's real research behind it. The first is that it can help with weight loss. Intermittent fasting can help to reduce your calorie intake naturally and can help your body burn fat by reducing insulin levels. Studies show that it can lead to a 3 to 8% reduction in body weight over a 3 to 24 week period. The second potential benefit of intermittent fasting is that it can help to improve insulin sensitivity. Now, this can be particularly helpful for those who are at risk of type 2 diabetes. It could also be helpful for those who maybe are pre-diabetic, or for instance, women with PCOS who may be experiencing some degree of insulin resistance. The third potential benefit is that it can help to boost metabolism when done properly. It can increase the levels of a body chemical called norepinephrine, and when this goes up, it can help the body burn fat more efficiently. Also, intermittent fasting can promote cellular repair by triggering a process known as autophagy, which is where your body clears out damaged cells, and this can potentially reduce your risk of diseases like cancer or even Alzheimer's. And number 5, intermittent fasting can potentially improve your heart health. It can potentially help to improve cholesterol levels, reduce blood pressure, and inflammatory markers as well. So yes, intermittent fasting, when done properly, does more than just helping you lose weight. It can improve your overall metabolic health. That said, intermittent fasting is not for everyone. For instance, if you are pregnant, if you are breastfeeding, if you have a history of eating disorders, or you have medical conditions like type 2 diabetes, please speak to your healthcare provider before you even think about participating in intermittent fasting. Also, you have to keep in mind that you may get irritable, hungry, or even very tired, especially when you first start out with intermittent fasting. The third thing to pay attention to is that if your meals aren't balanced during the eating period in intermittent fasting, you might miss essential nutrients, and in the long run, that can lead to nutrient deficiencies. Lastly, for some, especially those who already have a tendency towards having unhealthy eating habits, intermittent fasting may potentially further worsen these unhealthy food relationships and may even lead to binge eating. So please remember, intermittent fasting isn't about starving yourself. It's about creating a sustainable eating rhythm, one that works for you. So if you are thinking about going on an intermittent fast, then here is how you can do it safely. First, start slowly. For example, you can start with a 12-12 fasting window and then gradually walk up to longer fasts like a 16-8 fasting window. Also, make sure you focus on whole foods, your lean protein, healthy fats, vegetables, whole grains. The third thing you have to do is to stay well hydrated. During your fasting hours, fluids like water, black coffee, and unsweetened tea should be your best friends. You don't want to get dehydrated, trust me. And number 4, please listen to your body. If you start to feel unusually tired or dizzy or unwell, please stop and go see your healthcare provider. Remember, the goal is to find a rhythm that supports your health goals. Which begs the final question: is intermittent fasting worth it? Personally, I think a more sustainable method of losing weight is by embarking on a calorie deficit. A calorie deficit where you still end up eating properly all through the day. In fact, that's why this is my first video on intermittent fasting. Usually my videos talk about being on a calorie deficit while still enjoying your favorite meals and staying full throughout the day. But hey, if you really want to try intermittent fasting, then there's usually nothing wrong with it as long as you do it properly and you listen to your body. Thank you for watching this video to the end. If you are still here watching, just comment here in the comment section so that I know those of you true members of the Toluverse who watch my video to the very end. Alright guys, if you loved watching this video, you are definitely going to enjoy the next one showing now on your screen. Click on it and enjoy. Bye.